Hi friends, today we are going to learn about Rheumatology OSCE. I am your friend internal medicine doc, and let's proceed with the cases. This person is rheumatology man. Uh, our first case is 45 years old female who came with complaint of joint pain, morning stiffness and joint deformity. You have to tell the deformity, diagnosis, other deformities seen in this condition, and autoantibodies, criteria and the treatment option. Rheumatoid arthritis is one of the most common questions asked during OSCE. You have to know each and every deformity. Usually they ask about swan neck and the bottom ear deformity and the jet deformity and hallucis valgus. But you have to know the other deformity. They may ask you during your viva house. So you have to see the images of all the deformity. You have to know about the extra-articular manifestation of the rheumatoid arthritis, especially Felty syndrome and the large granular cell leukemia. Then pulmonary and the cardiac manifestation. Autoantibodies seen in rheumatoid arthritis are RA factor and anti-CP antibody. Diagnostic criteria is AC EULAR and more than 6 points are required for the diagnosis. Treatment options available are DMARDs, that is disease modifying agent in rheumatoid disease, and they are hydroxychloroquine, sulfasalazine, methotrexate, leflunomide and igatimod. You have to know everything about methotrexate. Biologics, TNF alpha inhibitor, that is infliximab, golimumab, etanercept, abatacept, CTLF4 co-stimulation inhibitor, anakinra, interleukin 1 antagonist, interleukin 6 inhibitor, tocilizumab, sarilumab, rituximab, monoclonal antibody against CD20, and JAK kinase inhibitor, tofacitinib, padacitinib, and baricitinib. Before giving biologics, you have to test for HIV, HBsAg, and hepatitis C, and latent tuberculosis. If patient is found to have a latent tuberculosis positive, you have to give INH prophylaxis for 6 months. Now next case, we have a 24 years old female who came with complaint of rash, hair loss and the joint pain. You have to tell the diagnosis, antibodies, diagnostic criteria, histopathological classification of lupus nephritis and treatment option. As you can say, there is a maculopapular rash present over the nasolabial which spares the nasolabial fold, involves cheek and the bridge. This is malar rash, or also known as butterfly rash of the SLE. Antibodies seen are anti-nuclear antibody, which is one of the most common. Then most specific antibody is anti-DHDNA and anti-Smith antibody. Other antibodies you have to remember, they may ask you anti-histone antibody is seen with the drug-induced lupus, and anti-phospholipid is seen with APLA syndrome. Then you have to know the pattern of antibodies and ACR EULAR criteria. More than 10 is required for the diagnosis. ANA more than 1:80 is the entry criteria for ACR EULAR criteria. Then histopathological classification of the renal involvement, that is CNS, that is renal lupus or lupus nephritis, is minimal mesangial, class 2 is mesangioproliferative, class 3 and 4 are focal and diffuse, and class 5 is membranous encephalopathy, class 6 is advanced sclerosing lupus. Treatment option available in case of SLE is NSAIDs, glucocorticoid, hydroxychloroquine, methotrexate, steroid sparing agent like MMF and tacrolimus, and cyclophosphamide in severe cases. Then biologics, rituximab and belimumab. Third case, you have a young female came to you with a complaint of reduced mouth opening and the ulcers and discoloration of the hands. You have to name the disease, condition associated, and 2 autoantibodies seen. As we know, the condition is scleroderma. Condition associated with scleroderma is CREST syndrome, renal failure, severe PH, RTA, erosive arthritis, and neuropathies. Autoantibodies seen most commonly are topoisomerase and RNA polymerase 3 with a limited disease, it is centromere and anti-TH or TO antibody. Then OSCE 4, this is a previous year question. You have to name the sign and the disease associated. The answer is it's a keratoderma hemorrhagica seen with reactive arthritis. Then OSCE 5th, you have to tell the sign, other condition associated, and name of the disease and antibodies. This is dermatomyositis. The first image you can see is of Groton papules. Second is heliotropic rash present over the eye. Third is Scholl sign and V sign seen around the neck, and Holster sign, that is seen around thigh. Autoantibody seen in anti-Jo1 and anti-MD5. Dermatomyositis is a precancerous disease. Then OSCE 6, identify the sign and name two conditions associated. This is livedo reticularis. Associated conditions are SLE, APLA, and medium vessel vascularitis. In APLA syndrome, you have to remember Sneddon syndrome. That is APLA with stroke. APLA, livedo reticularis, and stroke. Thank you. Like, share, and subscribe.